Hello, 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 hello. You can hear the voice behind the scene. Hello, hello. It is nice to see you again. You are welcome to this channel where we talk about life, career, awareness, and everything in between. You are welcome. Today we are talking about grief. Yes, grief, how to manage grief. And today I have with me a guest. He's a doctor in, of neuropsychiatry at Abeokuta in Nigeria, and he's here to educate us about grief, because at some point or the other, at one point or the other in our different lives, we have faced it in different forms, and some have been through it and come out of it, okay, while others have actually tipped over the line. And we know we all have different thresholds for pain and grief and loss and all of these things. So he's going to be talking to us today. And without further ado, I will just bring him up on the screen. He is Dr. Adegboyega Ogunwale. You're welcome on the screen. You're welcome, sir.
Thank you.
Can you
Thank
please
you very
introduce
much.
yourself?
Well, my name is Boyega Ogwale. I'm a psychiatrist. I work at the Neuropsychiatric Hospital, Aro, Abeokuta, Southwest Nigeria. And it's a pleasure to be on the platform tonight.
Thank you very much. Thank you very much. So the first question is, what exactly is grief? It might be a big word to some people listening, or is there a medical word for it? Is it a medical word? Just what is grief?
Well, I think grief is an English word, and it's got comparable terms in different languages of the world. But beyond being an everyday word, it could also be seen as a technical word in medical practice, particularly in psychiatry. So grief can be described basically as an emotional as well as behavioral response to bereavement. And you will realize that I've introduced another word, which is bereavement. And there's a reason I do that, because grief is a reaction. And a reaction to what? Bereavement. Bereavement itself is the loss of a loved person to death. So effectively, grief is an emotional as well as a behavioral response to the loss of a loved person to death. I could argue that grief could, in a narrower sense, apply to the loss of a loved object beyond a loved person, but I wouldn't want to go into those arguments just yet. And then the last bit I think I should mention is that in addition to grief and bereavement, there is a third component, which is called mourning. So mourning is a culturally appropriate manner of demonstrating grief. So bereavement is the loss of a loved person to death. Grief is a reaction to bereavement. And mourning is a culturally sanctioned or culturally appropriate manner of demonstrating grief. I'd like to put it that way.
Oh, okay. So if I may get that definition of mourning again, you said it's a culturally appropriate manner
of demonstrating grief.
Of demonstrating grief. Because I'm writing that on the screen for people who are catching up.
I see.
Demonstrating grief. Okay, great. Thank you very much. And so is grieving actually necessary after a loss? What do you think from a doctor's perspective?
Well, I mean, to say that you want to look at it from the point of necessariness, I think it's quite an interesting perspective, because grief is a natural human response to loss. So it's not a question of whether it is necessary or sufficient or any of those philosophical, considerations. It is a natural, very natural response to loss, particularly the loss of a loved person. And then there are several stages of it. So it's not something you choose. It comes upon you. It is thrust upon you. It is cast upon you by your circumstances. So I would say that in a sense, it is necessary, but in a more profound way of looking at it, it is a natural response, which sometimes you hardly have a choice in or about. Yes.
Yeah. Okay. Thank you. Thank you very much. And so that takes me to a question of, can grief and loss actually lead to mental illness?
Okay. That direct link is not far-fetched, but may not be that direct, to put it mildly. So grief, being natural in response to loss, would normally not lead to any mental disorder. However, if there is pathological grief, then it could lead to mental disorder. And what do we mean by pathological grief? Of course, pathological means abnormal. So when grief is abnormal, it's on about 4 levels. One is an abnormal intensity of grief, which may be manifested by depressed mood or depressive features that are in excess of what you would expect in normal grief. And it could also have things related to intense anxiety beyond what you will expect in normal grief. That would be abnormally intense grief. Apart from being abnormally intense, it could be delayed. So you would expect that the first stage would have kicked in within 2 weeks. But if it is now delayed beyond 2 weeks, you would say that that sort of grief is delayed. Beyond being delayed, it could be prolonged. So you would expect that within about 6 months, the stages of grief should have all been negotiated. And after 6 months, you would have been expecting some degree of resolution. Of course, within the first year, you would expect that on the anniversary of that loss, one could have what you call an anniversary reaction. But effectively, after about 6 months of the loss, the grief should have been resolved largely. And then it could be distorted or inhibited. So I've mentioned abnormally intense, unusually prolonged, delayed. It could be distorted or inhibited. So when you don't find the normal features of grief at all, and or you find abnormal features, for example, a person grieving could perhaps hear the voice of the loved person who is already dead, but it will be very transient. It will not be prolonged. But for the person to now I say that I sit with him, I eat with him, we take a stroll together, that will be distorted. And that tends to happen in those who, in the background before the loss, could have been having some psychiatric illness. It's usually in such scenarios that you have distorted grief. But by and large, those are ways in which grief can become abnormal and perhaps ultimately lead to a mental health condition. Yes.
Wow. So grief could actually become abnormal when it.
Oh, absolutely.
Wow, wow, wow. So from what you said, it seems there are stages. You said, well, within 2 weeks, one should have overcome it, or if it's delayed, then maybe 6 months. And then you talked about 1 year anniversary. People should have grieved if it was distorted. Is it distorted? You said prolonged.
Yeah,
Yes, the
distorted
prolonged one
or
is 1 year.
prolonged. If it's prolonged,
Yes.
it then exceeds 6 months, roughly. But again, these are, how would I call it? These are general timelines.
Yes.
May not apply to every human being in that very strict sense.
Yes. Yes.
But generally speaking, that's what you would expect. Yes.
So, there's a question I have in mind about when people still weep. When you remember somebody and you still weep about it, maybe, okay, for example, I lost my mom like how many years ago now? Maybe 12 years ago or 13 years ago. Yeah, lost, well, almost 15 now. And when not me, but I'm just saying, in case when I remember maybe every anniversary and I'm still weeping about it and I'm still like wishing she was here and all of that, what would you class that? Does that mean I haven't grieved enough, or does that mean it's just symptoms of mental illness, or what would you classify that as?
Well, I'm sorry to hear that you've lost your mom. Uh, I haven't lost mine, so I'm sorry to hear that.
No, thank you.
The truth of the matter is, no, I mean, to whatever degree human beings try to resolve their grief within the timelines that I've suggested.
Yes.
But be that as it may, there are those who do not fully resolve
Mm.
certain issues surrounding that loved person. So occasionally, when those unresolved issues or psychic material come up in the mind,
Mm.
one could respond in an unusually intense way, like crying or just feeling rather low in your mood at such periods for only a short while. And for some others, it's not that they don't resolve those issues, but that they are having what you call an anniversary reaction.
Mm.
Now, to a large extent, what you will find is that even when you do weep or you do express some sadness about the loss of the person several years down the line, that mood change would not be of such an intense nature
Mm.
as to suggest that you are in any significant distress.
Yeah.
So, to an extent, one could regard that as just the mind full of memories of its own. So, someone says that the human mind is full of things forgotten,
Mm.
is
Yeah.
full. So, it's got memories
Mm.
full of things forgotten.
Mm.
I mean, that's paradoxical. If it's forgotten, it should not be there. But no, it's there, but it appears forgotten. And sometimes these things come up. In a more technical way, we could also think of some of these issues related to grief as what we call psychological conflicts that
Mm.
one had in relation to the passage of that loved person, or even issues of guilt
Mm.
regarding the loss of that loved person. And they may come up within the context of psychological conflict, and one would respond with a change in mood. One
Mm.
would respond sometimes with some defense mechanisms. For example, you could get angry 10 years down the line when you find that probably your loved person had died in a particular set of circumstances in which somebody had only recently died again. Then
Mm.
your anger is not so much because someone has died, but because there was an unresolved anger at the time your own loved person died 10 years ago, which you never resolved. And
Mm.
then the anger will come up and you're wondering, why am I so angry? And a lot of self-awareness would help to be able to process that. And then you can, move beyond it somewhat. Yes.
Yes, yes, thank you. Because you mentioned something about guilt. I know there will be situations where maybe, for example, situations where like a baby died in the car because the windows were wound up, and maybe they forgot the
Absolutely.
baby, or maybe hit somebody, and so somebody died as a result of someone's action, and maybe that
Yes.
person is the mother or the father, or whatever. That kind of, how does one grieve without always remember? I don't know. It's such a complex
It
question to ask, to be honest, because I've never.
is.
It's how do you help such a, well, I know we're coming to the support later, but what would you explain if that person starts? Would that be? Would you say there will be delayed grief with that kind of person, or prolonged grief, or distorted grief, or inhibited grief for that kind of person who feels they are guilty for the death of a loved one?
Okay, so I would say that in the first instance,
Mm.
that feeling of guilt could come up even if you were not responsible for the death of that person in any direct or practical way. So, in the second stage of grief, blaming other people by means of projecting your guilt or feeling guilty is a rather common phenomenon. So, the guilt that I have mentioned is not as unusual as you might think it is. The reason is being human beings and having what you call shared humanity. The people who are alive tend to feel responsible for the death of the person who has passed. They have a sense that maybe there was something they could have done to prevent the passage of that of the individual who is deceased. It's again a pointer to man's own view of his own invincibility. And then that continues and becomes like a guilt trip. But with a lot of support and counseling, the survivor can actually deal with that guilt feeling. So the point I'm making is the feelings of guilt when you have lost a loved person to whom you felt responsible is not so uncommon or so unfamiliar a feature. But it is also something that can be worked through with support and with counseling.
Yeah.
But to a large extent, by the time the individual begins to confront the reality of the loss, the circumstances of the loss, going through the mourning process, spending time with the memories of the departed, eventually people are able to resolve the grief. I mean, the guilt to a large extent, yes. But some hands, they project it, they get very angry with the world around them. And you might find that within the context of abnormal grief, in which there is this abnormal intensity. And if it were to persist, then it would require some level of psychological intervention, like counseling, like medication in some cases, and in some cases, care support.
Thank you.
Or psychotherapy.
Wow, thank you very much. So that takes me to my next question of what are actually the common symptoms of chronic grief? So those who have had a prolonged or distorted grief, what are the symptoms you see? Because if we don't know what the symptoms are, it's hard to help people or to be able to refer them to the experts like you. What are the symptoms to look out for if people are still have not overcome their grieving, if they're still having this distorted or prolonged grief?
Okay, so I think the first thing to quickly address or identify would be the stages of normal grief, because it will be easier to recognize the abnormal when you know the normal. So the stages of normal grief are basically three. The first stage is the stage of numbness, denial, a feeling that is unreal, that the loss is not real. And that lasts between a few hours and some days. And then the second stage would last for a few weeks to about 6 months. So about 2 weeks to about 6 months. And during that period, the person can have some difficulty with sleep, poor appetite, feelings of guilt, projection of guilt by way of blaming other people. The person can have illusions, that is, have seen things and misinterpreting what you're saying. Maybe in a dark place, you're beginning to see the figure of the person who is deceased and all of that. The person can actually have hallucinations of the voice of the deceased person speaking to him or her, or calling his name or something like that. But it's never prolonged, it's very transient. And of course, the person might be in a frame of mind in which he or she would want to sort of identify with the person who is deceased. So might want to do things the same way the person would do things, might want to keep things in the same order the person would like to keep them, might not want to have change schedules the way the deceased person would have liked to keep the schedules. And all of that, you could have that within those 2 weeks to 6 months. And thereafter, there's a resolution, a stage in which the individual now comes to terms with the loss and begins to get away from social withdrawal, begins to re-engage with social activities again, begins to engage in social organization, might now be able to put the things of the deceased away, and then begin to adjust to life without the deceased person. So these are the three stages broadly. Now, when you've got an abnormally intense grief, which might show features of a mental illness like depression or anxiety, what you would have then would be symptoms that would match a clinical disorder of depression or perhaps anxiety. So, for example, the individual might have a sad mood that is far in excess of what you would expect on account of the loss. The individual may become suicidal. So it's not a question of feeling like the world is not worth living because you've lost a loved person, but actually thinking of ways to end your own life because you've lost a loved person. That will be an abnormally intense grief and will be a red flag, a pointer that there could be some difficulty which will require some level of intervention. Of course, with the anxiety, some people might have panic attacks, and it could be far in excess of what you would expect in the first 2 weeks of the loss, which might be normal for some people in their grief. So if you now find that the panic attacks are getting more frequent and they are beginning to disable the person is not able to function socially, occupationally anymore, then you might think that there is a need to intervene at that time. Or perhaps the individual is not just hearing the voice of the deceased person, but is now hearing voices condemning him or her. You're beginning to have strange beliefs that other people find odd and are definitely not true, which we call delusions. So if you have sustained delusions, sustained hallucinations, of course, those would point to problems that would need intervention. And of course, if someone hasn't got any features of grief at all after about 2 weeks, of the loss, then you might be thinking, oh, could this be distorted grief? Could this be as a result of the suddenness of the event and the unexpected nature of it? Could it be because the person was exceptionally close to the deceased individual, or that this person who is having distorted or inhibited grief is someone who's had some underlying psychiatric illness prior to the loss, in which case the mental illness would not allow that individual to muster the typical cognitive responses or the typical, psychological reaction to the loss. So those are the things you'll be looking at. And of course, if the mental illness seems to be getting worse because of the grief, you might need to intervene at the level of treating the mental disorder as well as dealing with the grief, if that helps.
Thank you. Thank you. Thank you very much. I'm sure people listening would have would have learned from what you've just said. So many points, looking at red flags, abnormal grief, stages of grief. So you're welcome, everyone. If you're joining us, thank you very much for joining. Thank you for always being here, supporting, listening, and always sharing the video. Thank you, Joyce, Cheryl, Gospel Music. Thank you for coming online. And for the 3 people online, thank you very much. I know so many people have been coming in and going out to invite others. Thank you very much for doing that. We have with us Dr. Adegboyega Oguwale from who is a neuropsychiatrist, call it properly. Yeah. From the is a consultant of neuropsychiatrist hospital in Aro Abeokuta. Thank you very much for finding time to join us. Now, when people lose a loved one and they say, oh, don't cry. Is that actually a good advice to tell someone who is grieving? Or say, oh, don't cry again, or just wipe your tears, don't cry, it will be well. What do you think?
That practically takes us into mourning. As I said, it's culturally determined. So in some cultures, it's the way to go. You don't cry publicly. You are encouraged to hold it together, and then perhaps when you are by yourself, you can do all the crying you'd like to do. So again, it's not something that is easy to sort of judge from a very objective external point of view.
Okay.
But having said that, I think it's important to stress that it is not very helpful to encourage people to inhibit their grief responses. So let the people who are grieving express their grief within the context of what is termed the normal grief, without saying that people should become pathological in their grief. It is natural that when you've lost a loved person, you'll be pained. And in reaction to that pain, you might wish to cry. So it should not be seen as an awfully terrible thing to cry, even if you do so publicly. But if the cultural milieu is such that you shouldn't do that, I guess with time, those who are members of that culture would know how to strike the balance between inhibiting the grief and allowing the person to express the grief response. So I guess from a technical point of view, the point to be made is that you shouldn't inhibit grief. You should not encourage people to restrict themselves from expressing
Mm.
the physiological reactions or psychological reactions to their loss.
Yeah.
However, it can be done in in a culturally acceptable manner, and those who are members of that culture will be familiar with how to get through it. I mean, to a large extent, being someone from an African descent yourself, you
Yeah.
will realize that even when we say do not cry, we don't mean don't cry.
Mm.
We mean just take heart. So because the fellow who is telling you not to cry is actually crying and telling you not to cry, then both people eventually end up crying together. Yeah. So it's got a nuance to it. It's
Mm.
not like say you beat your grief. Even when they say you're a man, don't cry. What they mean is that there is the macho kind of facade that
Mm.
you are supposed to protect. But beyond that facade, when you are all by yourself amongst men, you are free to actually express yourself and cry. Yeah.
Mm.
So
Mm.
I think it's the cultural inflection that we need to get right. Yeah.
Yeah, thank you. I'm sure I will get to that part where we I'll be asking about how to help people grieve their loss. But before then, what are the steps to manage the grieving process? What are the steps you think people can adopt to manage a grieving process?
Thank you very much for that profound question. I guess the first thing that must be borne in mind is that grief is a natural reaction to loss, particularly loss of a loved person. To that extent, if you allow nature to take its course, you would have done well. So people should not be too eager to abort, transform, or sort of regulate the grief reaction.
Mm.
Because I see too many times people say, well, she's not going to be able to sleep, and therefore let us medicate her immediately, even in a prophylactic manner. And I'm saying no, not being able to sleep for the first few days is actually part of the natural response to the loss. So if that lack of sleep is now going to interfere with the well-being of the person in terms of having the current headaches for over the next few days, feeling very unwell, yes, you may intervene with some anti-anxiety medication, which will calm the person down and hopefully get the person some sleep. But it should not be a prophylactic response.
Mm.
There are those in the morning are unable to, who on the first day are unable to sleep, or and by reason of that sleep deprivation by the next day are able to sleep without any medication. So the first point is let nature take its course. Let people grieve because it's a natural response. Now, the second point would be provide support. Support is key when people grieve.
Mm.
So sometimes the support could be as non-intrusive as just sitting around the person and not even saying anything, but allowing the person to see that we're here if you need us. Now, apart from that support, I think one very important element that we frequently miss is practical help. So within that support, you must provide practical help. So this person who has lost a loved person may be unable to cook, may be unable to look after an infant child. Maybe you just lost a young husband and you've got an infant of maybe a month or 2 months. That person needs practical support, practical help with that. So if there are bills to pay, if those supporting can help to settle the bills, take care of appointments that can be resolved by them externally, I think those are the practical things that should be done. They actually help the person to grieve normally and resolve grief faster. So those are the things we need to do. And of course, beyond those early interventions of support, practical help, and allowing nature to take its course, will then come things like in the first phase where there is numbness, and denial, and inability to sleep, and all of that. You might, on first phase like that, you might think of an anti-anxiety medication. And in the second phase, where it's more consistent with depressed mood, feeling tired of life, just losing interest in things, unable to sleep, unable to eat. In some cases, when it is quite profound, people use some antidepressant medication to help at that point. But of course, whether anti-anxiety or antidepressant, these decisions will be made by the experts. And it is only when people realize that the grief is getting rather intense that we would perhaps need these medications to support the individual.
Thank you. Thank you very much, Dr. Ogunwale. Um, Thank you for those who are online joining us live. Please ask your questions. We have our expert here who is ready to answer any question at all about grieving, about mental health when it comes to grieving the loss of a loved one. So please, please, please send your questions in because we will be rounding up soon. We've done 30 minutes already and we don't want to stay here forever, but we want to get it done very quickly. So please send your questions if you have any. I know you've mentioned it in the course of the talk about how to grieve. But for the benefit of those who are maybe joining us, just joining, and are asking in their minds, is there a proper way to grieve? Could you please answer that question? Is there a proper way to grieve?
But well, uh, thank you for framing it in that way. The only problem I will have is with the word proper.
Okay.
As I said earlier on, in general, or generally speaking, grief would come as a natural response to loss,
Yeah.
the loss of a loved person. So what is proper for one person, it would not be proper for another person.
Sure.
So in some cultures, it will be proper for you to throw yourself heavily on the ground, put your two hands on your head, raise a very terrible, terribly loud sound of anguish, and then burst into tears. That would be very proper in some instances. And in others, you just have to hold it together. You allow the tears to drop silently, quietly, and you deal with your pain without creating a scene or being too dramatic. Both would be proper in my view, depending on the circumstances and the cultural, situation. So what I think is a proper way to grieve is first, allow the individual to naturally respond to the loss in that person's own individual manner. And we're all different.
Yeah.
On your part, as a person providing support, make sure you are around that individual to help the person go through the stages. So, for example, the first stage is one of numbness. The person wouldn't know what hit him or her. And your duty will be helping the person to come to terms. Might not succeed immediately, but that will be your task. Well, my friend, my sister, my boss, please take heart. The loss of your husband, of your brother, of your child is quite painful. Or take solace in this fact that he lived a good life. What you're trying to do is to help the person to confront the reality. Because at that stage, the person has not. The person is numb. The person does not see it as real. The person is in denial. So you see all of that and you try to intervene by helping the person to realize that what is unreal is actually real. That what the individual is numb to is actually a practical pain, a true pain, which the person has to bear and resolve. And then by the time you come to the second stage, the person would be probably identifying with the deceased, would want to search for the deceased in very indirect ways, wanting to do the things the deceased person would do, having a very intense desire to be with the deceased person, might be unable to sleep. To help that sort of person grieve, I think would be to encourage the person to rest, to sleep, encourage the person to eat, and look for ways by which you can make food interesting to that person. Look for fluids, look for, the snacks that the person might want, might desire, if the person wouldn't want any other meal for that matter. And then look at ways to help the person to realize that though he or she's got a very intense desire to see the deceased is actually now gone. And one way to do that would be to ensure that the grieving person is part of the whole process of mourning, the whole process of planning maybe the funeral, being present at the funeral, having pictures of the deceased person. I mean, I saw a young widow who asked to see her late husband's body before it was moved to the mortuary.
Mm.
Now, some might say, no, don't see him that way. Remember him only as the vivacious, very buoyant and vibrant young man. No.
Mm.
If you allow that, you will be perpetuating that first stage of denial.
Mm.
If you allow to see the dead body, the corpse, whether at the morgue or before the morgue, it will really help to make that loss real.
Mm.
And once it is, the person can deal with it and resolve it.
Mm.
Yes, so these are practical ways by which you help people to grieve. And you can see that I have not attacked the issue of whether one way of expressing the grief is proper or not.
Yeah.
That
Yeah.
word proper would be difficult to define in any given set of circumstances. It will be quite, it will be diverse. It will be unique to the individual or individuals involved.
Wow. Wow. Oh, that's a lot to take in. Thank you very much. So I
Yes.
know there are so many, like you said, the cultural. You mentioned the cultural aspect of grieving, or is it mourning now? I should call it mourning
Yeah.
grieving.
Yeah.
So
Grieving, but that's mourning. Yes.
yeah, mourning the person who has died. I know there are, I don't know, in your profession, have you seen some, I don't want to say weird, but have you seen some cultural things that you would have thought, if you were not from that culture, you would have thought, that looks strange, because we are all learning here now. In case we know someone who says, oh, this is what I want to do to mourn this person, it won't be, oh, this person has gone, this person has a mental illness. We'll see it as that is the culture. So have you seen different cultures? Can you give us examples of different cultures that you've experienced, or you've seen or you've heard, how people mourn? I know some people say, oh, they invite people to come and cry with them, cry for them or cry with them. I don't
Yes.
know. I bet I don't know, those criers or something like that. So there are different things that happen. I just want to know. And if you're watching, you know of any cultural way of mourning that might sound strange to some people but are normal to others, please share with us on this, on the in the comment, post a comment, please. Yes, okay, over to you, sir.
Yeah. To a large extent, I think the interesting thing about culture
Yes.
is its relativity.
Hmm.
So again, it will be difficult to say that one form of mourning is normal and
Hmm.
the other form of mourning is weird. So in my view, what is weird in a place is normal in another.
Another. Hmm.
So as a psychiatrist, it's practically difficult to say that some mourning practices could be weird, but maybe I could argue that certain mourning practices could be rather dehumanizing to
Hmm.
the widower or
Hmm.
to the widow.
Okay.
And such dehumanizing practices should be discouraged because ultimately they can then lead to abnormal grief
Hmm.
as well as mental disorders, not necessarily within the context of grief per se. So the grief can then be the trigger or the precipitating um, factor for the mental disorder, rather than the mental disorder being an extension of the grief or
Hmm.
a part of the distortion of the grief. So I think that's the part as a psychiatrist I should address. So
Okay.
where you must force a person to shave off her hair because she's the widow of a deceased person, I think while it is culturally appropriate,
Hmm.
if it's something that the widow would feel is dehumanizing, it's something that with time could gradually be phased out. But again, I cannot pontificate on culture. I'm not,
Yes.
an
Culture.
anthropologist. I'm not a cultural expert. But
Hmm.
I think that's the element to look at. What
Hmm.
does it do to a human being? What does it do to you, the self-esteem of the surviving relation or
Yeah.
relative of the deceased person? In some cases, it's very easy for the relatives of the deceased to accuse the surviving spouse of having caused the death as part of their way of grieving. Then they attack that person, deprive that person of all material possessions that were supposed to be so are due
Yeah.
from the deceased partner.
Yeah.
And that to me might be their own way of grieving or resolving their loss,
Hmm.
but would be dehumanizing and not helpful for the person who is the surviving spouse. Because ultimately,
Hmm.
it could be the basis for a mental disorder or the basis for prolonged grief
Mm.
or generally pathological grief. So I think that's the technical point to raise. Whatever would then affect grief negatively
Mm.
should not be encouraged within our cultural perspectives or viewpoints on mourning.
Mm.
Whatever mourning approach we choose or we adopt should be such that it will preserve the dignity of the human being and not serve as a stressor, which could then lead to
Mm.
prolonged grief or mental disorder.
Yeah,
Yeah.
yeah, yeah. Thank you very much, because it's so there's a fine line between, grieving and then having some external forces wanting to tip that emotion over to, the other side.
Something quite negative. Yeah, quite
Yes,
extreme.
yes,
Yes.
yes.
Yeah.
So, there are just two more questions I have. If you have any questions, guests who are online, please ask your questions. Type in the chat, type in the comment down below, and let us ask Dr. Ogunwale the questions we have for him. So, two more questions. What could happen if a person refuses to grieve their loss? Is it
Okay. As
bottled
I
up and
said,
they could
that would then
explode?
be,
Yes.
yeah, that would then be some form of inhibited grief. It
Mm,
could be some sort of distorted grief, and it could be some sort of delayed grief. In any of those instances, it will be an abnormal grief. So being abnormal, it could then be related to someone toward outcome like mental disorder,
mm,
generalized anxiety disorder, or even a specific anxiety disorder, what we call a specific phobia. It could be related to a psychotic breakdown in which the person loses contact with reality
mm,
and the person will be having delusions and hallucinations. It could become something that could make someone who had a mental health problem to relapse and
wow.
have a fresh episode of mental disorder.
Mm,
And it could also be, that sort of stressor that could lead to relationship difficulties without necessarily a mental problem or a mental breakdown. It could lead to relationship difficulties,
mm,
which then will be a secondary factor in the mental breakdown at some point. So for me, I think the way to look at it is once grief is abnormally expressed, it could itself be linked to a mental disorder directly or lead to social problems in terms of relationship difficulties. And because there's an underlying conflict, psychological conflict, if it is not resolved, you will just see that there will be a lot of problems going on within that person's social milieu until the problem of the grief is largely resolved. So, for
mm,
example, somebody who is grieving and is not demonstrating the grief appropriately or is inhibiting the grief, the person might actually manifest with risky behaviors like dangerous driving or risky sexual
mm.
behaviors,
True.
just going on a sex rampage in town and not having any interest in protecting himself or herself from sexually transmitted infections and all of that. Someone might look at him and say, "Well, what's wrong with this chap? Why is he so morally
Loose.
morally questionable at this
Mm,
point in time?"
mm,
Meanwhile, what the person is actually experiencing is that grief which is inhibited
mm.
and manifesting as risky behavior. Yes.
Wow, 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 wow. That's profound. Thank you very much. Thank you. Finally, how? Because we've talked about different, ways of in which people grieve. The prolonged one, the inhibited ones, you know, some might last 6 months, some might last 2 weeks. Depending on how we all react individually.
Yeah.
And you mentioned something about helping people physically. Maybe if they're not unable to cook, you can cook for them and
Yes.
all of that.
Practical help. Yes.
Yeah. So yeah, practical help. So my question is, how can family and friends help them grieve proper? That word properly is coming up again. how can how can
Yeah.
without
I
using the word
think
properly? Okay, how can we help? How can
yeah,
family and friends help?
you are irretrievably bound to the word proper. I must suspect you're a very proper lady yourself. So I mean, in my view, I think as I had said earlier on,
Mm,
first let nature take its course.
mm,
Don't inhibit the grief externally. Don't tell the person, don't grieve at all. Forget it as if nothing happened. Understand the different stages of grief. The first stage is one in which there's numbness, there is
Yeah.
denial, there's a feeling of unrealness about what's happened. Your duty, your task as supporting structures would be to help the person to come to terms, to leave the sense of denial and to face reality. The second stage is one in which the person wouldn't like to eat, is unable to sleep, might hear voices, might hear the voice in particular of the deceased person, might have a very strong desire to be united with the deceased person or to be with the deceased person,
Yeah.
might not want to disrupt the schedule that the deceased person would have wanted to keep. I remember one close relation of mine was talking with the surviving relations. I was saying, oh, the deceased person wouldn't want us to do that, as if the deceased person were still around. Now, that was part of the grieving. And it will be the duty of family and friends to say, well, the person is not around now, as we all know. Let us all sit and deal with the fact that the person is not around and let us move beyond that point gradually. Now, that helps the person to face the reality and say, why are you moving daddy's chair from where it would normally put it? We are moving daddy's chair because we have to reorganize our lives because dad is no longer here. And that takes us to the last stage of resolution when we can now move daddy's things or mommy's things out of the wardrobe and someone else can stay in that room. And to an extent, you sort of integrate that reality of the loss into your daily lived experience. It becomes so real that you have made peace with it, and it becomes something that translates into fond memories of that deceased person rather than a sense of intense grief each time you think of that person. A sense of pain and anguish when you think of that person will be replaced with a sense of satisfaction that that person lived a good life and was such a beautiful thing that the person shared life with you. So to an extent, that's what family and friends should do. Just help the person to move along the stages and not try to get in the way in any significant manner. However, it's also the role of family and friends with the knowledge we now have that if there are red flags of being suicidal or being so depressed as to lose weight and be hopeless, helpless, and feeling worthless, it might be the duty, it will be the duty of family and friends to seek professional help and ensure that interventions are undertaken in a timeous manner and with people who are quite well trained to do so.
Thank you. Thank you very much. Thank you. I can't thank you enough because you've really shed a lot of light. So we all grieve differently. So one person's way of grieving might not be the other one's way of grieving, and so we should allow nature to take its course, like you said, allow nature to take its
Absolutely.
course. Thank you.
Absolutely.
And you've also said from the psychiatric's point of view now that we need to discourage dehumanizing forms of mourning
Mourning
because
practices, yes, indeed.
yeah. Okay, thank you very much. I haven't got any more questions, but if there are any more questions, viewers, for Dr. Ogunwale, please write in the chat and he will see them after this broadcast. Thank you very much. Thank you very much. So practical help is important to help aid the grieving process. I hope we've all heard that, and I hope that we'll be inspired to help people who are facing grief, the grieving process, in whichever way they want us to. Some could be quiet. Some, yeah, and I almost have a question that how
I
do you help
know
someone who is
you
not
ran
ready
into
to
another
help
one.
to be helped? How do you help someone who is not ready to be helped? Maybe someone is lonely and they just had a loss and you're doing everything possible to help them. Is it at that point when you say that, oh, person doesn't this person is suffering in silence, and you're thinking there's no one else around to help that person? What would you do? How would you help that kind of person to overcome, oh, okay, somebody is saying thank you to you. So how would you help that person to
Okay.
not hasten, but help them grieve without
to
causing harm to themselves,
go
because like you said, there's a tipping point, there's an excess.
yes.
And some people just want to be quiet, they don't want anyone coming to them, they want to be locked up somewhere. And it's hard for others to help them when it comes to that stage. So it's all, I don't know, God help us. I don't know what to
Yeah, I
say.
mean, to be honest, it is very difficult to help someone
Mm,
who does not wish to be helped.
mm,
But having said that, I think the way to look at it is very frequently we who wish to offer help are almost deluded into thinking that we are the only ones who can provide the help.
mm,
So sometimes it's not that the individual does not want help, but the individual does not want that sort of help, and certainly
mm,
not from you.
mm,
So sometimes what you need to do is to be more observant, keep in touch, stay in touch, and based on your power of observation, see if you can be the bridge
mm.
between the source and kind of help that the person needs and the person himself or herself.
Wow.
That would be very helpful. Rather than to think, I hold the four aces, I'm the one who would help this person. I don't see anyone else who can.
Mm,
Several times it's because we can't observe the individual who is suffering
mm,
closely enough. We should keep in touch, stay in touch, and see if we can be the bridge between the source and type of help that the
mm,
person needs and the person self or herself. That would be very helpful.
Thank you. Thank you very much. So abstain from being pushy at, at
It
that
doesn't
stage.
help ultimately.
Mm.
You get to become sort of some sort of an intrusive person.
Mm.
And once you get intrusive, the person
Person
draws
will
a
switch
line,
off.
creates boundaries that you can't breach. And, the person becomes inaccessible to your help
Mm.
largely. Yeah,
Yes,
so
true.
we say just keep in touch, find a way to keep in touch and observe from afar.
Mm.
Somehow you eventually find the kind of help and the
That's
source of help that will be
required.
acceptable to
Mm.
that person.
Yeah, yeah. Wow, you.
And if the person wouldn't want help at all, sometimes it would be a red flag, which
Mm,
would trigger mental health intervention. Yes.
mm, mm, mm. Okay, helping us to draw a line. Wisdom, wisdom, wisdom. Thank you. Thank you very much. I really appreciate your time here. Thank you very much, Dr. Ogunwale. Is there any other last words you want to say to people um, before we call it a day or a
I mean,
night?
well, just to wrap up, we
Okay.
know now from our brief discussion this evening that grief is a natural response to the loss of a loved person
Mm,
through death. That this natural response consists of emotional as well as behavioral elements.
mm,
We have said that grief is in reaction to bereavement, and that the culturally appropriate manner of expressing grief is mourning.
mm,
That there are different stages of grief: this early stage of numbness, of denial, to the middle stage of loss of appetite, difficulty with sleep, transient hallucinatory voice of the deceased person, urgent desire to be united or wanting to be with the deceased person or wanting to change schedules and things like that. And eventually, the last stage of resolution.
mm,
That as support structures, we have a duty to allow nature to take its course, and that we provide support, engaging in practical help. And we should identify red flags that would trigger mental health intervention. That health intervention would include things like counseling, psychotherapy, medication, support systems, as may be the case. And on the whole, that grief being natural and allowed to proceed naturally several times gets resolved without any extreme external intervention.
mm.
I thank you very much for inviting me.
Wow. Thank you. Thank you. Thank you very much. We really appreciate your time here. I wish you all the best in your career and we hope to see more of you some other time.
Thank you very much
Thank
for
you.
inviting me once again, and I wish you The same. Have a very pleasant evening.
And you, thank you. Thank you very much. So, viewers, you've all heard that. You've heard it all from Dr. Ogunwale. We just, if you need to rewind and watch this over and over again to really understand what has been said, please do. Please share, like, comment, subscribe if you want. And thank you for those who are subscribers already. Thank you for always supporting. Thank you very much, and I wish you a good evening. So, till we'll see you next time. I'm hoping all of the questions we have for on Slido, we have questions have been asked generally on mental illness. Those questions will be treated next week, and we will come your way again. So, till we come your way again, stay safe, stay calm, stay connected. Thank you, and bye bye.